So today we are going to discuss ALL versus AML. First of all, we will discuss the hematopoietic stem cell lineage, myeloid progenitor and the lymphoid progenitor. From the myeloid, you will see the formations of the platelets or thrombocytes, erythrocytes, and the myeloblast. Myeloblast further form the monocyte, basophil, neutrophil, and eosinophil. These are all white blood cells. Lymphoid progenitor, you will see the formations of the lymphoblast, in which you will see the T lymphocytes and the B lymphocytes and the natural killer cells. So, AML disturb the myeloid lineage and ALL disturb the lymphoid lineage. Origin: ALL, acute lymphoblastic leukemia, affects lymphoid stem cells, which produce the lymphocytes, as we have discussed, lymphoid progenitor, lymphoblasts, B and T lymphocytes, and the natural killer cells. AML, acute myeloid leukemia, these affect the myeloid stem cells, which produce the red blood cells, platelets, and other white blood cells like the neutrophil and monocytes, as we have discussed. Platelets, red blood cells, and these are the white blood cells. Next, group H, ALL, acute lymphoblastic leukemia, mostly common in children, but can occur in adult as well. AML, most common in adults, particularly older adults. So that is the most important thing. ALL common in children, while AML common in adults. Next, if we talk about the symptoms, in ALL you will see the fatigue, fever, bone pain, swollen lymph node, frequent infections, and easy bruising. While in the AML, you will see the fatigue, weakness, anemia, frequent infection, easy bruising and bleeding, noticeable gum or skin involvement. Cell appearance. Lymphoblasts are the abnormal cells seen in blood and bone marrow, as it affects the lymphoid lineage. In AML, myeloblast or promyelocytes are the abnormal cells seen in blood and bone marrow, as it affects the myeloid lineage. Progression, rapid progression if untreated in both case ALL and the AML. Next, diagnosis. How we will diagnose the ALL and the AML? ALL, bone marrow biopsy showing lymphoblast abnormal. Flow cytometry and genetic test confirm subtypes. In AML, bone marrow biopsy, we will take the bone marrow biopsy showing myeloblast, abnormal myeloblast, flow cytometry, and the genetic test. Genetic abnormalities. In ALL, associated with the chromosomal abnormalities like Philadelphia chromosomes T922. While in AML, you will see the chromosomal abnormalities like T821, INV16, and T1517. Treatment. Chemotherapy is the mainstay, often followed by main therapy. So in this case, you will see the targeted therapy like tyrosine kinase inhibitors may be used for specific genetic mutations. While in AML, you will see the chemotherapy is standard. Targeted therapy FLT3 inhibitors and bone marrow transplant may be necessary for certain condition. But treatment can vary according to the patients and according to the condition at that time. For the prognosis, ALL higher cure rates in children, 80 to 90% lower in adults. But in AML, varies based upon subtype, age, health, and but generally worse in older adults. Special subtypes: T cell ALL, B cell ALL. As we have discussed, it affects the lymphoid lineage. Includes the subtype like acute promyelocytic leukemia APL, which has a specific treatment with all trans-retinoic acid ATRA. So, key differences: Cell lineage, ALL affects lymphoid cells while AML affects the myeloid cells. Demographics, ALL is most common in children, AML is more common in adults. The treatment strategies and outcome differ significantly based on the specific leukemia subtypes and the patient factor. So this is all about the difference between the ALL and the AML. If you still have any question, you ask in the comment section. Thank you so much.